Hello everybody, in this video we will speak about communication techniques and that will help us during the consultation to build a reliable therapeutic relationship and to motivate the patient for change. Let's start with a quote of a famous psychotherapist, Petrushka Clarkson. More and more research studies demonstrate that it is the relationship between the client and psychotherapist more than any other factor that determines the effectiveness of psychotherapy. It is success in psychotherapy can best be predicted by the properties of the patient, psychotherapist, and their particular relationship. Petrushka Clarkson was a very clever woman and she was a specialist, a trainer in many approaches, many schools of psychotherapy. And it is the result of her whole life experience that it is the therapeutic relationship that is most important and influences most the result of the therapy. And in Bach therapy, it is the same. So what does it mean, a therapeutic relationship? Simply speaking, it's just trust. The therapist, the patient trusts the therapist as a person, as a professional. He trusts the method and trusts that his problem is solvable. And let's start with the techniques or with the methods that do not help, they even disturb the relationship. Like ordering, directing, warning, threatening, extorting, giving information or advices without permission, persuading with logic, disagreeing, judging, moralizing, blaming, interpreting, analyzing, posing questions. It's surprising, but the problem isn't posing questions in itself, but it is important how many questions we pose. Sometimes the patient may feel like filling in a questionnaire, so he stops thinking and waits for a question instead of speaking spontaneously. And agreeing, praising, and especially throwing marshmallows. It's a psychological term meaning that you praise insincerely. You praise something that is not worth praising, for example. And instead of that, a better technique called affirmation will be explained later. And the most important technique you need to learn is so-called empathetic listening. And this technique can improve immensely your treatment results if you learn well it. The principle is very simple. It means listening to the patient and giving him the feedback how you have understood what he has told. And it seems very, very simple, but listening to is a very special skill, and most therapists or most people do not have this skill well developed. And the reason why the active listening so important is that people like when the other person listen to them and understand them. That's the reason why people meet each other, why they speak about daily problems, or family matters, about work. They do not expect that the other person offers some solution. They just like to be listened, and they like when the other person understands them. They feel they are important for the other person. And if you appreciate something like that in a daily communication, so imagine how the patient will feel in your consulting room when you listen attentively to him and understand him, how important it is and it will be for him. Of course, when you share some problems with the other persons, the sharing itself helps to reduce the pain and suffering. And another reason why active listening is so important is that you need a reliable information for a good prescription. We can imagine the facts or the situations in our life like an iceberg, and the words correspond only to the upper part above the water, and so it's imperfect. We can see something and we can imagine how the iceberg looks under the water, but it's only in our fantasy. I can demonstrate it on a few examples. For example, the patient tells you, I'm feeling badly. Everybody can feel sometimes badly, and for everybody this feeling means something different. For example, I may feel guilty, or I may feel sad. Somebody may feel like a victim, or just it may mean that I do not like criticism or that I have a fear. Uh, it People often abuse some medical words uh, for expression of their feelings, but they may also believe that the therapist understands the word, so they needn't explain it, so they can avoid painful feelings that are behind this word. However, for example, the word depression may mean in somebody's language, I feel sad. Somebody may mean I feel angry. For somebody it is feeling tired. And somebody may have a fear of losing self-control, losing control above his emotions. Or simply just I feel irritated by the other persons and want to be alone. Let's demonstrate one example from my real practice. A woman comes and she speaks about her dad. Her dad is seriously ill, and uh, he used to be strong and self-sufficient, but now he needs a lot of help with almost everything. And the patient tells she feels terribly. So, what's the idea? Well, the idea might be, and my experience is that most people in this situation feel fear for the dead. Or another possibility is that they may feel sad because the condition of her dad is deteriorating, getting worse and worse, and she is sad because he will never be as he used to be before. So the idea is either red chestnut or honeysuckle. So I will use one of the techniques of motivational interviewing or of active listening. I will use a reflection that uncovers the underlying feelings. So I told her, you have a fear for him. This reflection explores the theme of red chestnut. If I wish to explore more honeysuckle theme, I would tell her something like that, like you are sad and because your dad will never be as he used to be before. However, her reaction was quite surprising. No, not fear. I have two brothers, and we had an agreement. I would take care of our mom, and they would take care of our dad when necessary. So I had expected that my dear brothers would take care of him, but they refused. It's so much work, and I have no time for myself. I am so angry. So the theme is, in fact, willow. And the best technique or most frequently used technique for active listening is called reflection. And reflection just means that you repeat the content of patient's last sentence using your own words. For example, when I have to wait sometimes somewhere, it makes me angry. And the reaction might be, for example, time is precious for you. Or I try to avoid unnecessary conflicts, and the reaction is you do not like conflict. Very simple. This problematic can be rather complex, and the reflections are really very, very important for a success in the therapy. So we will deal with reflections in detail in the next video. So thank you very much for watching this video. I hope you have enjoyed it. And in the next video we will speak about the communication techniques part 2.